Hello dear patients. Today I would like to briefly talk about treatment of ureaplasma and to give a clinical example of people who come to me. A young man came to us and in dermatovenerologic dispensary he had ureaplasmosis diagnosed. This bothered him, there was a burning in the canal, there were small discharges and itch. So ureaplasma was diagnosed and he was prescribed ibuprofen according to the scheme for 10 days. It undoubtedly led to some improvement. Then in about 2 months these complaints relapsed, although he did not have any sexual partners after treatment, so the possibility of repeated infection is completely excluded. He had ibuprofen on his own. There was no need to go to doctors again. As a result of that, in half a year he came to me with discharges of mucopurulent character that you can see on the picture, as well as with pain in the area of anus, with frequent urination, etc. So in analysis, leukocytes of about 15 to 20 were found, meaning urethritis, inflammation. Ureaplasma was found in PCR analysis, meaning that it remained. But I emphasize again that during that time he had no sexual contacts at all, be it with condom or without it. There were pains in the anus. Ultrasound study was done. Prostate secretion was taken and inflammation was found here and there. I can say that quite many patients come to me after going to those dermatovenerologic dispensaries. Can we heal ureaplasma, mycoplasma, etc. by tablets? In some cases it's possible, but in quite a high percentage, I never counted it though, I have enough patients, including young men and even my colleagues, doctors. It can happen that ureaplasma or mycoplasma disappears, but quite a severe erythroprostatitis develops. You can watch a separate video about treatment of ureaplasma. This video is quite detailed. So I've not seen such consequences in any of the people who I treated using a complex method. When I was serving in the army, we put such patients into hospital for a reason, but now we only use tablets. So what is needed for such patients? Culture test for ureaplasma is needed, particularly if pill-preferring doctors have already spoiled it all. Secondly, a complex treatment of erythroprostatitis is required. Thirdly, washing of the canal is necessary. I always prescribe electrophoresis with Lidasa to such patients, as it opens the ducts. We do it for 20-30 minutes, for the time that a common dermatovenerologic dispensary just does not have. Again, at least 2 antibiotics have to be changed. Fourthly, anti-inflammatory therapy is required, such as intramuscular longidasa, during cases of erythroprostatitis. Some immune stimulation is also required, so a complex common treatment that takes some time, but usually if the patients come before all these problems, then it almost always leads to healing. During my whole practice I have singular cases which, when after such complex treatment, there were some complications, etc. However, quite many people come to me with such complications. Recently I had a patient who had to leave with chlamydiosis. He moves to another city, not to Moscow, and I advise him to be treated there. I explained that it's better to have a good complex treatment than to have a joint disease later on or to have erythroprostatitis, etc., as this may lead to complications and I see it in my practice. My message in this video is as follows. I don't argue with that, as I never tried to treat using tablets only. Probably some patients can be healed by tablets only, but the risk of severe lifelong complications, even if this risk is small, means that I wouldn't advise anyone to do it. Remember that a normal complex treatment that does not require a lot of time or a lot of investment leads to healing and absence of any consequences. So I would advise not to just eat tablets if that's possible, particularly if the infection stays in the body for a long time and you are not aware of it and it gives inflammatory reaction, as in our case, inflammation and leukocytes. Don't listen to the doctors who say that it's possible not to treat mycoplasma, gardnerella, etc. Particularly mycoplasma, ureaplasma urealyticum produce early cases of prostatitis, and I see them in my practice. You can leave it without treatment, but unfortunately fact remains the same. Indeed, quite many men came to me suffering with such chronic infections and complications after listening to those who suggested not to treat. This is one more term. There are doctors who prefer tablets, there are doctors painters who only paint, and there are doctors who advise not to treat. So don't listen to those people and their reasoning, suggesting that in low concentrations ureaplasma and mycoplasma may not bother. Indeed, it may not bother, but as soon as you drink alcohol or overcool yourself, then it would start to bother you and you won't know about it. I would advise a full-scale treatment of any focus of inflammation, particularly in sexual organs, as this leads to a good healing and you won't need to think about such consequences. If it is necessary to diagnose and treat any latent infections, you can consult venerologists and urologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such infections. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.